Getting an annual flu vaccine is the first and best way to protect yourself and your family from the flu. Flu vaccination can reduce flu illnesses, doctor's visits, and missed work and school due to flu, as well as prevent flu-related hospitalizations. All the details about where you can get yours is coming up next on Polk Place. Welcome to Polk Place. I'm your host, Tina Mann, and joining me in the studio today are Kelsey Rondini, CDC Public Health Associate, and Leslie McKay, Epidemiologist with the Florida Department of Health. Welcome.
Thank you.
All right, let's talk a little bit about why flu season is in the news all the time. Why is that important?
Sure. Well, the flu is a viral illness. And the flu season usually runs somewhere from October until May. It could be a little later, and it could go on further than May. This viral illness causes respiratory problems. Besides fever, you can have cough, you can have a sore throat, you can have headaches, body aches. You're really going to feel sick. Mm-hmm. And it's a little bit different than just a common cold because it could be much more severe. Especially for certain vulnerable people like children, infants, maybe pregnant women, people who are immunocompromised, people who live in a nursing home. Those are usually more vulnerable.
It's important to note when you're talking about these vulnerabilities, people like me are like, well, I'm not vulnerable. But then it becomes an issue with if I get it and then I'm around people who are vulnerable. Correct.
Exactly. So that's a good point. We like to emphasize this. If certain people, like babies, younger than 6 months of age, they cannot take the flu shot. So the parents could get the flu shot, so they prevent the flu from getting into their house. So that's a good point. The same thing like doctors or nurses, staff from nursing homes, they should all get the flu shot to prevent the flu from getting into the building. And that's an extra step that they'll be taking to protect their patients.
I assume teachers are the same way, people in a school-related setting.
Correct.
So are there any other populations who can't get the flu shot? Is there anybody not able to?
Typically, most everybody could get the flu shot, but they can check with their doctor. Even pregnant women, sometimes they worry, are you sure I can get my flu shot? Yes, you can get it anytime during your pregnancy. It's safe.
You had mentioned briefly about, colds and people might get confused between the two. What are the main differences between the cold and the flu?
Typically, it's severity. So the flu would be typically much more severe. It can actually land you in a hospital bed, so you don't want to be hospitalized, right? And what's your best option to preventing the flu? It would be getting your flu shot.
Okay, but say I am having symptoms. What should I do?
See your healthcare provider as soon as you can, and he or she will be able to assess your symptoms, see what's going around in the community. They can test you for the flu if they think it's necessary and take it from there.
And then what happens when they test for it? I mean, if you do have it, I know we're trying to prevent it, but what are they, the treatment's not fun, right?
Well, and that's the other thing. Once they determine that you do have the flu, the doctor may or may not prescribe you antivirals. So it's important that you discuss that with your healthcare provider, and they'll know whether you should take it or not. I like to point out also that you don't typically get antibiotics for the flu because the flu is a virus, and antibiotics are not used to treat viruses. So unless you develop secondary infections down the road, which is something serious that could happen from having the flu.
See, there's a whole trickle-down effect, so we need to get our flu shots.
Sure.
So talk to me a little bit about flu shots. What are they and what do they do?
So flu shots are the best way to prevent getting the flu during the flu season. We come out with a new flu shot every year because the influenza virus that's circulating every year during the flu season changes. So we need a new one every year to try to best fight that. The typical flu season, like Leslie mentioned, is anytime between October and May. However, the peak flu season changes every year. So some years it could be in February, and some years it could be in November near Thanksgiving. So it's really important to get that flu shot so that way you're protected for the season. At the health department, we like to say vaccine before Halloween. So try to get your flu shot before Halloween. That
That's
way
an
you're
easy way
best
to remember
protected. And you get it once and you're protected for the whole season.
Is it just for the season, or is it like a year, or?
Typically just for the season,
Okay.
especially since the virus that's circulating will change, and you'll need to get another one the following year.
I know that I see them advertised everywhere, as far as, pharmacies and different places like that. Where all can people go to get flu shots?
Yeah, flu shots are available pretty much everywhere. You could get it at the pharmacy, like you mentioned, drugstores. You could get it at your primary care provider, or at some grocery stores even. Their primary care provider should be your first step, if that's available to you. If not, the Department of Health also offers it. But really anywhere you could get the flu shot.
What if people are concerned about cost?
Yeah, absolutely. That's something to, if you have a primary care provider, to talk about it, depending on your insurance plan or the Department of Health. We have options as well. You can call to make an appointment and talk about, fees, or if it's free, depending on your age, things like that. Or different walk-in clinics might offer it.
Excellent. And I know that I've noticed an increase in employers around the area also offering them to their employees. Have you noticed that as well?
Yeah, absolutely. The Department of Health offers it to us, and we see that actually some hospitals, they both require it, that their employees have the shot, and offer it to them. So a lot of people are starting to get it now.
I know a lot of people's hesitation with getting the flu shot is because they've heard the myth that, they're going to get the flu from getting the flu shot. So why don't you talk a little bit about why that isn't possible?
Sure, yeah, that's definitely a myth. The flu shot that you get is not a live virus, so there's no way that you could get the flu from getting the flu shot. The way the flu shot works is it teaches your body what to look for if you're ever exposed to the flu during the flu season. And so when you get the flu shot, it can actually take a couple weeks for that shot to take effect and best protect your body and teach it what to look for. So we do recommend even more so get your flu shot before Halloween. Also be aware that it could take a little bit to work effectively.
Let's talk a little bit about prevention, because once you've got the flu shot, you could still carry the virus around with you, but how do you prevent, not that you're going to get sick from it, but how do you prevent illness in general? I mean, are there steps you can take?
Yeah, so first, get your flu shot. Besides that, washing your hands frequently, especially during flu season, and washing them properly. So for a correct amount of time, making sure to get, in between fingers, things like that. What most people don't know is the flu virus, if you pick it up and then you touch a surface, it can stay on that surface for between 2 and 8 hours.
Wow.
So if someone else comes by, touches that same surface, and then touches their face, they could then get sick because they've just picked up that virus if they're not vaccinated. So that's something to keep in mind as well. Washing your hands, like I said, avoiding people who are sick, that's key, and not going to work if you're sick. Please stay home, especially if you're one of those sensitive situations like a healthcare worker, daycare worker, food handler, things like that. Those are all very important.
And I know in school they teach you to vampire sneeze, to act like the count and
Yes.
sneeze into your elbow instead of out into or even into your hands, because then it ends up on your hands and you can transmit germs that way. Well, this has been really informative. Is there anything else we should know about the flu or the flu vaccines?
Well, I guess you can see that we're trying to make a point for everybody to get their flu shot. But we like to emphasize that the flu shot is especially important for those who take care of the most vulnerable among our population. So healthcare providers, nursing home staff, long-term care facility staff. Maybe if they do get the flu, they wouldn't be that sick. But if they bring the flu in to the building where they work, that could bring more complicated consequences for those who reside there or for the ill patients in hospital settings. So again, very important. We know many hospitals are requiring that their staff get vaccinated, and that is great. But we still see every year many outbreaks, flu outbreaks or influenza-like illness outbreaks throughout the state in many nursing homes and long-term care facilities. And the nursing homes and the long-term care facilities usually do a great job in vaccinating the residents. But they have to take the extra step to encourage their staff to get vaccinated as well, for those reasons that I mentioned before.
Right.
So that's a message that we want to leave out there.
Absolutely, and I don't think we mentioned it, but the reason, I mean, for you and I who would get sick with the flu, we would just be sick for, a couple of days. We'd be miserable, yes, but those people are actually at risk of death or, severe complications. So that's why it's important to not only protect yourself, your family, but everybody who's around you.
Correct. In fact, we are all at risk. However, those are much more at risk than we are of developing complications from the flu.
All right. Thank you for coming out today.
Sure, thank you.
Thank you for having us.
Every year when the fall season approaches, the Florida Department of Health reminds people of the dangers of flu season. Influenza is responsible for serious illnesses and deaths each year, but there are simple steps everyone can take to reduce the chances of catching the virus. Increasing the number of people who get vaccinated each year helps to protect more people, including older people, very young children, pregnant women, and people with certain health conditions who are more vulnerable to serious flu complications. For more information about fall flu season 2017, you can give the Florida Department of Health Polk a call at 863-519-8300 or look them up on the web at polk.floridahealth.gov.